Well, how should I introduce Dr. Laffranchi? Laffranchi, maybe a round of applause would be appropriate. The topic is acute and chronic infections that do not respond to conventional treatments. May I have 30 seconds? I'd like to just make a short tribute to you. Dr. Laffranchi, in 2001, correct me if I'm wrong, 2001, very courageously, Dr. Laffranchi put together a group within the hospital, in 98 actually. He put together a group, and I remember 2001 because the first conference was actually here, and I had the pleasure and honour of attending. And then I was not able to attend after that date. However, I would say that in a centre of excellence such as this, of which many are extremely proud, including the Lombardy regional authorities, a centre of excellence at the European level, which organises events such this, where dialectic is more than just announcing good results, and where many things arise from a very big heart, and a group of big hearts, Dr. Berrino, a group of people, because Dr. Laffranchi is not the only one in the group. Well, I think all that deserves consideration, because they are steps in the right direction, and 10 years ago, at an institute such as this, it would have been impossible to talk about Elenin or phytopharmacology or such. And if it has become possible, and will be increasingly possible, then on behalf of all of us, please say yes if you agree. Before you begin, I would like to give him another round of applause in acknowledging again his efforts. Thank you very much. Thank you, Dr. Milani. Dr. Milani was, in fact, the person who taught me to broaden my horizons, and had I not met Dr. Milani, none of this would ever have taken place. I've been working here for 25 years. I'm a diagnostic radiologist, and so I do diagnostic radiographs, but I'm also in contact with the world of radiotherapy. Some of the people I work with are here, and working alongside my colleagues, oncologists, surgeons, radiotherapists, who really suffer every day when their patients are very sick. Some of their patients have cancer, some do not, but it is nonetheless dramatic, because there are situations that at times just defeat every effort to resolve them, and in an attempt to help and to efforts have been made to put aside conventional medicine and to venture into a new world. And I'll now describe how. This is something of an unusual presentation. I'll be helped by a few people, because I would like to try and recreate what the patient feels and what the doctor feels. The doctor who would be myself, and you'll see this at the end. So medicine is based on the scientific method. Therefore, you have to formulate a hypothesis, then you need to conduct tests, experiments, to support the hypothesis, and then the hypothesis has to be proved to be reproducible. That's scientific film showing us something rather interesting. We're at the Faculty of Pharmacological Science. Research is conducted here. We're in the hematology department, where we're working on an experimental model of bacteriosis. The equipment is very sophisticated, and it generates a laser beam. This is how the equipment is set up. We've got a monochromatic argon laser beam. The laser beam goes through a lens, a shutter, and a camera directs the laser beam onto the bacterial load for so many seconds. The laser beam goes through the microscope and comes out through the lens, and it creates a lesion on the area to be treated. Initially, the animal is treated with a solution, a control solution of physiological solution. In the microcirculation, we identify the arteriole that will be hit by the laser beam. The beam destroys between 1 and 2 endothelial cells. The platelets are instantly present to fill the gap that's created. The platelets aggregate and form a thrombus. Under the pressure of the blood flow, the thrombus detaches and forms an embolus. We then realize that this is induced on the wall at the site of the lesion. Next, we inject a dose of aspirin, 15 CH. Again, the operator directs the laser beam to the arteriole, to the chosen arteriole. In response to the laser beam, a group of platelets occurs, develops, and this tends to narrow the arteriole. The flow slows down. The lesion that's generated creates a thrombus, and the thrombus is much smaller than the control. Under the same conditions, with the same beam, you can see that the thrombus spreads itself along the wall. Aspirin, 15 CH, perhaps causes a change to the wall. The third stage is the injection of a high dose of aspirin, 100 milligrams per milliliter per kilo of body weight. The lesion is smaller, and unlike previous treatment to 15 CH or the control treatment, there is no thrombus formation, simply a very weak activation, platelet activation. The differences detected may be explained by the fact that aspirin, high-dose aspirin, impedes cyclooxygenase. At low dose, aspirin acts at the wall level, at the parietal level. These that I presented. Okay, so what does the film actually intend to say? Here we're looking at a very clear experiment, incontrovertible, where you can see aspirin in its normal function, why we often use it as an anti-aggregant, and homeopathic aspirin, 15 CH, which, according to what we believe, should be a placebo, but it has a very different effect than physiological effect, preventing thrombus, the inversion of the effect. And this is what the concept of homeopathy is based on, similar to treat similar, etc. And what I'd like to do now is get into my lecture proper with the help of a few friends, and